Hi, time waits for no one goal to improve public awareness about diseases, especially when cure is possible with early detection and treatment. As all of you know, last week of September is the Ovarian and Breast Cancer Week, and our goal today to improve your awareness about ovarian cancer.
One of the finest careers in American gymnastics.
She tumbled, soared, and vaulted into Olympic gymnastics history in 1992 and 96. This is Shannon Miller today, a 34-year-old wife and mom facing perhaps her toughest opponent, ovarian cancer, discovered during a routine exam last December.
It was during that exam that they found a baseball-sized cyst on my ovary.
And you were feeling fine?
I had absolutely no symptoms, and I think that's why I'm just so passionate about talking to women and telling them to get their exams, because you don't have to be feeling bad.
Shannon had the cyst and an ovary removed, then underwent 9 weeks of chemo.
And it's such a personal thing, but I think once you just embrace it as a symbol of health, of I am doing this so that I can be here for my family. I can be here for, for me, looking at my son who's 18 months old every morning. Yeah, I'll go bald for you. I will do whatever I need to do so that I'm here for you.
It's hard to recognize ovarian cancer, especially when it occurs in young women. But when you meet Samantha, a 19-year-old ovarian cancer survivor, it's easy to recognize her courage, strength, and optimism in the face of this disease.
I was telling my parents for a very long time that I didn't feel well. Going up the stairs was difficult for me, which was weird because I was a soccer player, I played lacrosse. So for me, having trouble going up the stairs, it was a pretty big deal. I knew something was completely wrong. They took me to many doctors, and a lot of the doctors diagnosed me with something else, like IBS. One doctor said I pulled a muscle. I knew it was more than that. Finally, they did a sonogram, and they saw a huge ovarian mass in my stomach. It was the size of a basketball. At 18 years old, it's very rare to have ovarian cancer, so they thought it was just a cyst. They removed one of my ovaries. I found out I had grade 2 tumor, stage 1 ovarian cancer, and they told me because of my age, chemo could affect me in the long run. I wouldn't be able to have children, and they didn't want to do that to me, so luckily I just did surveillance. No matter how old you are, it's important to be checked, because if you do, then you're going to be okay, you're going to survive, and you're going to be strong.
When detected early, ovarian cancer is beatable. You should know the signs, know the body, and of course, know the facts. Just hearing the words ovarian cancer can be scary. We understand that. In fact, it's the reason we assembled this comprehensive look at the risk factor of ovarian cancer, the symptoms, and the treatment options. After all, if you or someone you love is going to fight ovarian cancer, the best thing you can arm yourself with is information. Unfortunately, due to the fact that ovarian cancer is often diagnosed in its late stages, it causes more death than any other gynecological cancer. The good news is, when discovered early, it's highly curable. Ovaries are located in the pelvis, one on each side of the uterus. Ovaries makes female hormones and produce eggs. Let's learn about ovaries anatomy and ovarian cancer causes.
The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. One function is ovulation, or the release of eggs that are needed for reproduction. The other main function of the ovaries is to produce specialized hormones such as estrogen and progesterone. These hormones help to regulate ovulation. They also prepare the inner lining of the uterus to proceed with the pregnancy. Cancer and its causes. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing without normal controls, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. If the tumor does invade and destroy nearby cells, it is called a malignant tumor or cancer. Cancer can sometimes be life-threatening. Cancerous cells may also spread to different parts of the body through blood vessels and lymph channels.
Every woman is at some risk for developing ovarian cancer, but certain factors can increase that risk. The risk of ovarian cancer increases in women after the time of menopause. Knowing your family history is important because the gene is important as a risk factor also for ovarian cancer. The family history of breast cancer is also a major risk factor. A mutation in one of the genes called BRCA1 or 2 is a risk factor. Previous diagnosis of breast, uterine, or colon cancer. Eastern European of Jewish descent, and infertility. These factors are important for you to know and to discuss with your doctor for proper screening and prevention.
Symptoms of ovarian cancer are vague and are oftentimes mistaken for things like indigestion. You know, you've had a big Italian meal and you feel like bloated. And that can happen, of course, but the idea is when you feel it repeatedly, when you feel symptoms that don't go away.
The most common symptoms include bloating, pelvic and abdominal pain, increased abdominal size, feeling of fullness, gas, nausea, and indigestion, constipation or diarrhea, unexplained weight gain or loss, frequency and/or urgency of urination, unusual fatigue, shortness of breath, abdominal, postmenopausal vaginal bleeding.
Even early stages of ovarian cancer can produce symptoms. If you experience these symptoms daily for more than a few weeks, you should see your doctor or gynecologist. Bloating, pelvic or abdominal pain, acid reflux or heartburn, urinary symptoms, urgency or frequency. Additional symptoms also include fatigue, feeling full quickly after eating, back pain, pain with intercourse, constipation or diarrhea, abnormal vaginal bleeding or irregular periods. To diagnose ovarian cancer, genetic testing, for example, BRCA, if possible, needs special treatment or surgery to remove ovaries. To diagnose ovarian cancer when suspicion is high, it requires pelvic exam, rectal exam, transvaginal ultrasound, CA-125 assay test, which is a protein released by certain ovarian cancer and can be detected in blood, imaging like CAT scan and MRI, and, if it's needed, a biopsy.
I said that I wanted to surprise my husband, that I wanted to have my photograph taken so that he would have something to sit on his desk, because I knew that I would be without my hair for a really long time. And that was true. I wanted to preserve something for him, but I also wanted to preserve something for me, because I knew that I could be losing my life, that was a possibility. But what was definitely a probability was that I was going to lose my hair and my figure and all of those things that I had come to think of as feminine. And so that there would be before cancer Angela and an after cancer Angela. I knew that there would be a before and after, and I wanted that recorded. I knew that I was going to lose that life, and I didn't know what that was going to mean. So I wanted to hold on to it in any way that I could. When I was diagnosed in December with ovarian cancer, that many people didn't think that I could continue going to school, which is what I had been doing. I had gone back to get my master's degree in social work, and it meant a lot to me. And I told them in the hospital that I was definitely going to finish that and get my degree. And the doctor supported that, but he shook his head and he said, it probably won't be possible, but you can try if you want to. And I decided then and there that I was going to do it. So when Randy and Shannon suggested that we do a second shoot, I didn't see any value in just me coming in and showing my bald head. But I did like the thought that I could come in and tell my story about what I was able to accomplish, even undergoing chemotherapy and even with this diagnosis of ovarian cancer. I thought that that had some value. And it'll be a story that I tell over and over and over again, that you can do it. So now I'm free. There's hope.
There are 3 types of ovarian cells from which cancers can form: germ, stromal, and epithelial. These 3 types make the majority of the cancers coming from ovaries. About 85 to 90% of ovarian cancers are epithelials, which start on the surface of the ovaries. This is the type that we should discuss and understand because it's the most common one. There are 4 stages of ovarian cancer. Stage 1, only in the ovaries. Stage 2, where it's spread out of the ovaries into the pelvis. Stage 3, where it's spread to the lining of the abdomen, to the fat and lymph nodes. And stage 4, where it's spread beyond all of the above into the liver, into the lung, and so. The treatment of ovarian cancer are many. Surgery in some circumstances when it's needed, chemotherapy for some patients who had the cancer spread beyond the ovaries, and we have the radiation treatment also. Additional treatment created recently related what we call target treatment, where they attack the mechanism led to the ovarian cancer. All of the above has some side effect, but the success is tremendously high and the cure is possible. we have a good organization which is taking care of the ovarian cancer patients. And we are proud to have the Ovarian Cancer Connection, who are doing a great job introducing enough information and knowledge to all of the patients in the area. And to understand the disease and the management and the treatment and the consequences, how to manage the situation on the long run, we like to talk to some of the experts in this organization who are doing a great job in that matter. First of all, I'm going to talk to one of the nurses who is doing that, which is Christine. Welcome.
Hi.
So what's the most from your experience, what are the most common risk factors the people report to you as a reasoning for the ovarian cancer?
Risk factors include especially mothers, aunts, first-degree type relatives that have had ovarian cancer or breast cancer. There is some relation to colon cancer as well, so a family history of colon cancer. Women are more at risk as they reach after menopause. However, we do have women that are as young as teens, 20s, 30s, having ovarian cancer. So age is not necessarily the only number that you look at. One of the other things that we need to let people know is that when you go in for your annual Pap test, that's a screening for cervical cancer, not for ovarian cancer. So your Pap test is not going to tell you if you have ovarian cancer or not. We need to check some other things to rule out ovarian cancer.
Great. That was very informative, Christine. We really appreciate you being here, and I hope with the information you provided and what we're going to show, we're going to give enough information and details about this disease and now about prevention and the treatment and to help our community. Thank you.
New medicines, new procedures. The more complicated healthcare gets, the more you need a special kind of expert at your side. Sure, Mercy physicians are leaders in using the newest medical technology, but something just as important never changes. A commitment to listening, to understanding, to finding the best option for you. The choice to be in expert caring hands? Choose a Mercy physician. Find yours at mercyweb.org/doctors.
From the local Ovarian Cancer Connection, I welcome Jenny Steinker, who is the president of that organization, who is going to give us some more details about this local organization. Welcome here, Jenny.
Thank you. Thank you for having us.
Thank you. Tell me something about your organization locally.
Well, we started in 2005 under a national organization, and our goal is to raise awareness and educate the community on the early warning signs of ovarian cancer, which is extremely important because the symptoms are so vague. So in 2005, we sent out letters to several nurses and survivors that we knew of, and we had 9 people show up at our first meeting, and the majority of them were survivors. And I'd ask them, I said, what do you want from us? What do you want us to do? And one woman said very quietly, she said, I have ovarian cancer, but I want my daughters, my nieces, my granddaughters, my neighbors, and my friends to know about this disease, because right now we don't know about it. There's really not much to say about this disease like breast cancer and other cancers. So we took that and we started building the Ovarian Cancer Connection.
Excellent. And we're hearing how you are growing tremendously over the last 6 years, and you are doing a great job, by the way. Yeah. And this program hopefully will promote to have new members and new involvement and more donations, because really we need the community to support that kind of organization, and it's very important to all of us. The second question really to you is, we always, when we are talking about organization like that, is the money. When the donation coming for the ovarian cancer prevention and treatment, is it locally or there's a national organization take over? Can you explain it to us?
Sure. 100% of our proceeds that we raise stay local. And it's really nice because staying in the community helps our survivors. It helps us to raise awareness and purchase the necessary brochures and educational pieces that we can get out to the community. It also helps us to get in front of physicians and medical students to let them know about the early warning signs of ovarian cancer. We also have recently just started a financial assistance program where we can provide financial assistance to the survivors who need a little bit of help with their rent or mortgage payments, insurance co-pays, prescription drugs. We also provide them assistance with their utility bills, and many of them have a difficult time in this economy getting to and from their medical appointments, so we provide them with assistance with a gas card so they can do that.
Absolutely. What are the other services which is the local chapter is able to provide these patients?
Basically, we provide them with information. We also provide them, after they are diagnosed, with a resource center. I receive many telephone calls, not necessarily from a woman who has ovarian cancer, but maybe has a history of it, or she's experiencing the symptoms because she's read our information, or she heard about it. So what I'm able to do is guide her in the right direction, whether it's to a physician. I don't give her any medical advice, but we're here as a organization to make sure that the women's fears are put at ease. You know, so, and we also provide the support to the survivors. We celebrate their survivor. We remember the women who have passed away. We haven't forgotten. And we do that through several fundraisers throughout the year also.
Absolutely. And I understand also you have an annual walk.
We do. We have an annual walk that's coming up on September 15th. It's at the University of Toledo Medical Center. It is our 8th walk, and it's in memory of Ellen Jackson. And it's just a wonderful walk because every year we change it up a little bit, but we're here to have fun. It's a family gathering. We want women with cancer to forget for a day that we do care, and we're working very hard to raise money for research, directing them in the right direction for programs that are available throughout the community and throughout the United States. But we also remember their caregivers, you know, because they need a break too. Absolutely. And so the last couple of years we brought in this band. It's called the Mad Cows, and they really get them hopping. So we have a great time.
That's good, that's good. As we mentioned earlier, ovarian cancer most commonly seen in older women 50 and above. On the other hand, there's a huge number of patients who are at young age. And today we're going to show you a real patient, the patient who is from our community, Alexandria. She is one of the patients who were a victim of ovarian cancer. Alexandria, welcome on our show.
Thank you.
I want you to tell us your age currently.
I'm currently 20 years old.
20 years old, and you were discovered to have ovarian cancer a few years back. How old you were when you were having that?
I was 15 years old when I found out.
What did you feel before they tell you that you have ovarian cancer? What were the symptoms, or how did you feel at the time?
Just very, very crampy. I had pains in my sides, in my chest, you know, from just being in so much pain. I was hyperventilating, and just a lot of pressure, a lot of pressure. And I had no idea.
You end up in the emergency room, and what did they tell you there?
I went to St. Charles, and they thought I had appendicitis, and they sent me to another hospital because they didn't have a peds section. They went in, they found out that I did not have appendicitis. I ended up having a stage 4 tumor on my left ovary.
Wow.
Yeah.
At age 15?
Yeah.
And I know that for the first few weeks your mom did not tell you that you had ovarian cancer, and you knew about it later. Did you have enough support from the family, from the community? I mean, was it helpful to be in this area? I mean, with that much of disease and that much of problems?
The community, friend-wise, yeah. My friends and family were very supportive. They, you know, were at the hospital, at my hospital side all the time. They were bringing letters, coming up and drawing pictures out of coloring books, and trying to cheer me up in every way they could. But the community, I mean, the Ovarian Cancer Society has been amazing. I cannot say that my personal community, I don't think they realized that a 15-year-old could get this. I don't know what they felt like what they were supposed to do. They didn't know how to handle it with the situation, who they were supposed to contact, you know. But yeah, my family, my friends who I did have within my community, and then extending communities from Ovarian Cancer Society and hospitals and doctors, they were great.
So do you think that the Ovarian Cancer Society right now and the Ovarian Cancer Connection is helping to change that experience, which was not that great from the community standpoint? Is it getting better?
It is getting better. I was a survivor for 2 years before I went to the walk. I had no idea about the Ovarian Cancer Society walk. And I went in 2010. I was 18 years old. I got some extremely strange looks from the older ladies, survivors that were there. But no, they have been great. I go every single year. I mean, they've helped me in multiple ways with people to talk to, groups to go to. Even though the survivors are more in their, older age, they will sit down and listen to everything I have to say.
Sure.
So, I mean, it's great to just be able to have someone to talk to.
Do you think that you are doing a service to the community at this point by having you here, talking to us about your experience?
Yes.
Okay.
Yes, I do.
What do you want? What kind of message you want to deliver to the public?
I want to deliver to the public, not to judge, first of all, because I've been judged for multiple things, and especially this has put a big damper on my life. It's made me not be able to do things that I've always wanted to do. It's actually made me disabled in certain ways. And I get judged all the time for, oh, why can't you go out? Well, I have a doctor appointment, or I have treatment, or I have this, and a lot of people don't understand, and they judge you. And the other thing is that no matter how old you think you are, you're never safe from this disease.
That's great. That's great. Really, we want from this message, and I want really Alexandra to express herself, and she did. She did a great job to this community. We want you to understand that age has nothing to do with ovarian cancer, number one. And number two, when you are a victim of ovarian cancer, that many things you're going to experience and you feel. And we need the people to understand. We need the people's support. We need the community support. And hopefully we can do a better job. And that's why Alexandra is here. Thank you. Good job.
Thank you.
We are at the end. Today it was a special day about ovarian cancer. They had their ovarian cancer walk sponsored by the Ovarian Cancer Connection. Get real about teal, because remember, time waits for no one.